Well, I think there's been a lot of focus on setting up ACOs and developing relationships that are needed for ACOs, as well as the financial relationships with the various providers. And I think one of the less discussed areas is really the need for working together across various providers, such as hospitals and primary care physicians, nursing homes, home health agencies, on the quality and patient safety measures. Because there are at least 33 measures that ACOs will be accountable for related to quality and patient safety of the care provided to their patients. One of the other main areas that they need to consider is the liability exposure that they might have for openly talking about quality and safety issues among different providers. There are some legal liability protections such as peer review protections that are available within a hospital setting. But once you start going outside of the hospital setting and including providers that are not within the same organization, talking about quality and safety issues, there is some liability exposure that those providers really should consider about how to mitigate that exposure so that they can openly discuss the issues, so they can learn about quality and safety, so they can put their best foot forward to improve quality and safety of care. I think historically that's really been where providers have been. So I think looking at the ACO structure, in order to be successful and meeting those quality measures, they're really going to have to start working together and not be competitive. One of the typical examples are pressure ulcers. The very serious pressure ulcers, one could say, really should never occur. And typically you have seen maybe a patient showing up from a nursing home in a hospital with a severe pressure ulcer, and the hospital says, well, they had the pressure ulcer when they got here, and the nursing home says they did not have the pressure ulcer when they left here. Well, obviously it didn't happen in transport between nursing home and the hospital. So instead of pointing fingers in that scenario, they're now going to have to figure out, most importantly, how to prevent the pressure ulcer in the first place, because they're going to both win-win.